Hey guys, welcome to my labor and delivery story. I know, better late than never, right? That's what I'm thinking. So I thought I would finally film this considering Autumn is now almost 3.5 months old. She was born on September 1st, and I thought I just have got a lot of questions about my labor and delivery story. I will link my labor and delivery story with my last baby down below so you can kind of compare how different it was, and I'll talk about it a little bit in this video. This is going to be pretty basic video, and hopefully you guys enjoy it even though it's kind of late. So let's get started. If you don't know a lot about me and you're just happen to be tuning in, my name's Melissa. I turned 30 a couple of weeks ago. I just had baby number 2 on September 1st, like I said. I actually have 3 children. Our oldest child, Emily, is adopted. She just turned 7. Our second, you can hear her. Our second, well, that's a third. Our second child, Madeline, is just turned 3, and she was my first pregnancy. And then my third child, Autumn, was my second pregnancy, and she is 3.5 months old now. All girls, I know. All girls. And if you guys are familiar with my channel, you already know this. I vlog daily. If you're interested in that, click the subscribe button. It'll notify you when I upload vlogs and different things. You get to see a nice peek into my life. Little Miss was not having it up in her bouncer watching TV, so she's gonna sit with us for the rest of the video, huh? Yeah, you are. Okay, so let's start with how the pregnancy went. I did upload a few pregnancy vlogs that kind of updated you guys along the way. This was a rough pregnancy for me. I don't know if it was because it was my second or because I had hurt my back this past year, or I'm not exactly sure what it was, but towards the end I was in so much pain from my hips and my back that it was unbearable. I mean, very much so. I wasn't getting sleep at all. It was just awful towards the end. It was to the point where I was telling my husband I couldn't do this again. Like, we could not have another baby. I could not go through this pain again. But then, you know, that subsided and I totally could do it again now. So, yeah, that's to say that we may not be done having kids. We may be done. I don't know. So I knew, if you have watched my labor and delivery story from Maddie, I was a C-section. I wasn't an emergent C-section. I was just a basic C-section from being a failure to progress. I only dilated to 5 centimeters, and that was that. I had labored all day, and 2 days actually. I had a Cervidil inserted into my cervix the night before on a Monday night, and I failed to continue to dilate past 5 centimeters the next day, which was a Tuesday. So I ended up having Maddie a Tuesday night, October 1st, 2013. She was 8 pounds, 8 ounces, 20 inches long, and I had her at 7:42 p.m. So I had already known going into, let me give you another background story. I am a labor and delivery nurse. I work as a labor and delivery nurse at the hospital that I delivered Autumn at and Maddie. Now, when I had Maddie, I did not work at that hospital. I just finished my nursing degree and everything, and I didn't start working at the hospital that I delivered at until Maddie was 9 months. So, and I've been there ever since. So this time around, even though I knew I would be a repeat C-section, was completely different than my first C-section because I knew everybody that was working on me. I knew the process. I knew what was supposed to go on and what wasn't, and I knew what to expect, and it was just a lot different, a lot different. Not only was it my second time going into it, I also had so much experience in the labor and delivery field. So that being said, I knew I was going to be a repeat C-section. I get a lot of questions as to why I didn't VBAC, which is a vaginal birth after a cesarean. I personally have been through those with patients. I know the risks. I've seen good outcomes and I've seen bad outcomes. So the risks just weren't worth it for me, especially knowing my history. It's not like a lot of women who have successful VBACs have not had their first baby via vaginal delivery because the baby was breech, or I get a lot of Indian women who are from the Middle East, and not even just Indian women, just women who are from the Middle East in general, and for whatever reason in that part of the world they like to do C-sections. So a lot of them come to live in the United States, and when they do that, they their doctors find out, oh, you didn't even get an opportunity to labor, they just gave you a C-section. And so a lot of times when women don't have the opportunity to labor, they have successful VBACs because their body could have done it in the beginning, but their baby was breached, something was wrong, whatever the case may be. With me, my body didn't dilate, and I think Maddie was in the wrong place at the wrong time. She was too big for my body, and it just didn't work out for me. So I knew, my doctor gave me the option, and I knew that I could try, but I did not want to risk. The risks are very, very high, and as I said, I have seen some very scary things happen with VBACs, and I just wasn't willing to put myself in that position to try for a VBAC, a vaginal birth, and it not work out again. That just wasn't worth it to me. So needless to say, I just scheduled myself for a repeat C-section. Now, I delivered Maddie at 38 weeks 2 days. I delivered Autumn at 38 weeks 4 days. I was scheduled for a C-section on a Thursday at 5 a.m. And the way that it works at my hospital is you just come in. My C-section was actually scheduled for 7 in the morning. You come in at 5 a.m. You get registered. You bring all your stuff because you're going to be staying. I got registered. They take you back, again, where I work, they take you back to the pre-op area, so they treat you just like any other surgery. Are you okay? Can you breathe? Are you just excited? They treat you like any other surgery. You go back to the pre-op area. They get you changed into a gown. I had to take off all my jewelry. They put me on the monitors so they can listen to her heartbeat. I didn't have one single contraction, not one. I didn't even have Braxton Hicks, although I really wouldn't know what they felt like because I wouldn't have been able to differentiate Braxton Hicks between back pain because I had so much back pain it wasn't even funny. So I didn't have any contractions. I wasn't monitoring with any contractions. Nothing. Totally different because with Maddie, I labored for a day and a half, almost 2 days. I had the epidural late in the game on my delivery day, and it didn't even work that well, and it was just a hot mess. I was in a lot of pain. No pain this time around. I sat there, she found the heartbeat, I sat on the monitor, she put my IV in. Now, one thing that's different too with the C-section is I wasn't that swollen prior to having Autumn. I was super swollen with Maddie. So as soon as I delivered Maddie, all my swelling kind of went down within a few days. I wasn't that swollen with Autumn, so they pump you with fluids for a C-section because you're going to be losing a lot of volume. You lose at least 500 cc's of blood during a C-section, if not more, depending on if you have complications. What's wrong? So because of that, they preload you with lactated ringers and just electrolytes and, you know, different things that preload your body to lose the volume and to not bottom you out. So, and by that I mean your blood pressure, so that your blood pressure doesn't bottom out. So she was pumping me full of fluids, and because of that I was super, super swollen. I mean, she gave me 2 liters before I even hit the OR, and probably another liter or 2 after that. So I was definitely full of fluid. So she gave me my IV, started that, and if you follow my vlogs, I will also link the video down below of the day that I delivered her. Just in case you're interested, because it kind of shows the pre-op area and me talking to Andres and just special times. So she got me registered, got me all my initial assessment done, and made sure everything was okay. The anesthesiologist came to talk to me. I knew he was going to do a spinal. You know what, actually, sometimes they do a spinal. He actually did an epidural. I had to think about it. Some of the anesthesiologists that I work with do straight spinals, some of them do epidurals. He did an epidural. So it's just like you would get an epidural when you're in labor. But before that, he came to talk to me. My OB came to talk to me. Everyone, you know, prepared me. Everyone came to say hi because they all knew I was there. Then they wheeled me back to the OR. I walked and got onto the operating table, which again was different because when I was laboring with Maddie, I was already numb from the epidural. They had to transfer me and I was in pain. And, you know, it's just a totally different experience. This was very, like, I knew everything that was going to happen. It was very fluid, totally different. So I got on the operating table. He came and did my epidural, which again feels exactly the same as a normal epidural would when you're in labor. I immediately started to get numb. My chest started to get heavy, which sounds scary, but that in the OR is, they give you a different amount of epidural. Sorry, my camera battery died. So I think I was talking about the epidural. So they do give you a different amount of medication during a C-section than a vaginal delivery. Sorry, I just had a coughing fit. But I couldn't tell you the exact dose because I'm not an anesthesiologist. I just assist during epidurals. I don't push medication or anything like that. So I know during a vaginal delivery they will give you a certain amount to numb you, but not completely, like where you can't move. Sometimes you do get enough epidural during a vaginal delivery that you cannot move. However, most of the time you may have a tiny bit, like if I'm touching you, if I'm touching the patient's leg or grabbing them or pinching, they can feel the sensation. But not necessarily be able to completely move. During a C-section, they will actually, if you're going from a vaginal to a C-section, they will give you an additional bolus of the fentanyl to completely knock out your bottom half to where you really don't feel anything, because hello, they are completely operating on you and opening up your abdomen. So going into this, I remembered kind of what to expect, but it was, you know, that sensation kind of goes out the window. You don't remember it completely. And initially it is scary because they lie you flat, completely flat. Now in my OR, they do tilt you to the left a little. So they'll put a hump underneath your right flank in the back. And that tilts you a little just to help with blood flow and stuff like that. So you're not completely flat, but it does, you're flat essentially, and your arms are laid out like this, your legs are straight. They do put a catheter in you into your bladder. Now again, for us they do that after you're already numb, so I didn't feel that at all. And some ORs automatically give you an oxygen mask. Mine does not, unless you warrant it. I was continuing to get fluids. I had already warned my anesthesiologist. Him and I have worked together several times. I already warned him that I am a very sick person. I get nauseous extremely quickly when I am under any type of really sedative, any type. So I told him that, and I told him my blood pressure is going to bottom, and I'm going to be sick and pale and cold and sweaty. And that's exactly what happened. And that's exactly what happened with Maddie as well. It happened when I got my epidural initially, and it happened when they took me back to the OR, and then it happened again when I was in the OR with Autumn. So I knew what to expect. I knew what he would give me, what he would do, and it wasn't scary for me. Now for somebody else, it can be scary because you're helpless. You're lying there and your chest feels heavy because that's what happens. You feel warm and tingly, and it almost makes you feel a little zoned out. Kind of like when you're at the dentist and they give you laughing gas. Makes you feel like that. Now there's plenty of moms that I have had that go in for a C-section after they have failed to progress for a vaginal delivery, and they fall asleep because they're just so exhausted from the day of laboring that they just fall asleep during C-section, and it's not a big deal. Now for me, that didn't happen because it was bright and early in the morning, and I knew what to expect. What'd you do with your passy? What happened to it? So I was wide awake, and essentially all he did once I started to get dizzy was give me some Zofran and more Zofran. And I think at one point he pushed Phenergan, which Phenergan gives me kind of like the shakes and makes me a little drowsy. So I think he gave me that at some point, and I had been maxed out on meds. I finally started to feel better. I didn't have anything in my stomach because that's one thing for any type of surgery. They tell you not to eat. C-section is no exception. You are at risk of aspirating, vomiting, and swallowing it, or inhaling it, and you could catch pneumonia and die. I mean, it's just as simple as that. And so I didn't have anything to eat, so there was nothing to vomit, but I was vomiting bile, like stomach bile. It was disgusting. So anyway, enough of that. They get started. The OBs come in and talk to you and make sure everything's okay. They ask you if you're getting your tubes tied, just to make sure I was not getting a tubal. So that was fine. They make sure I'm the right patient, we're doing the right surgery, we're in the right place, just different things like that. All normal things for any type of surgery. The difference between a C-section and a normal surgery is you are awake. You're consciously sedated. So you don't feel anything, but you are awake. So the anesthesiologist sits up by your head. At some point they had Andres come, and he sits up at my head as well. He could sit there and hold my hand and, you know, all that good stuff. They cover you with warm blankets because you do get cold, and OR is naturally really cold. And they start. So the nurse, which was a friend that I work with all the time, circulates. So she goes around and charts while you're doing it. She counts lap pads with the scrub tech. She just oversees the whole thing. If something goes wrong, she's there to get the medications, just different things. Well, I can happily say it was a very easy and smooth routine C-section, 0 complications, which I'm very fortunate for. I have been in many routine C-sections, scheduled C-sections that have not gone the right way, and I was very fortunate that nothing had happened. And I was so worried that I was going to have the nurse curse, because it seems like every nurse that has surgery, has a baby, something goes wrong, because you're in the medical field. Same thing as like a surgeon. I just feel like it happens to everyone in the medical field. I was very lucky that it didn't happen to me. Routine, my scar, she said that my uterus looked great from my previous scar. Everything looked great. I closed up easily. Now I do have to mention, with my last C-section, I had internal sutures and staples on the outside. So it was like double security, and I think a lot of that had to do with just my OB's technique, because there's many surgeons that do not use staples. They don't believe in them for a variety of reasons that I couldn't tell you. All of them have their own special technique. Some of them just close with sutures, some of them close with sutures and steri strips, some of them use Medipore tape. I mean, just a whole bunch of different things. Again, my OB uses internal sutures and staples on the outside, which she did this time, and I was very grateful for, because I had a wonderful healing process the last time, and an immaculate healing process this time. My scar is virtually invisible. So okay, so again, we did not know the gender. I had waited the entire time to find out what we were having, and so I had a mirror. This is one thing you guys can request in the OR, and a lot of people don't know this. Most people don't want to watch a vaginal delivery. Most people wouldn't want to watch a C-section, but I knew I wanted to watch mine. So I had a mirror above the operating table that I could actually see what was going on, and Andres was taking pictures the entire time. So we do have a lot of documentation of it, and unfortunately my iMovie won't let me insert pictures, or else I would put pictures of the actual delivery. But if you watch my last labor and delivery video, I inserted pictures of that C-section, and I was in the exact same place that I was last time, this time. So it's the same idea, just a different baby. So after, you know, she cut the cord, delivered, Andres got to announce that it was a baby girl, Miss Autumn Rose over here, and they took her to the baby warmer, got her all settled. Andres got to go over there and take pictures and be with her. They wrapped her up. She was perfectly healthy and fine, and they brought her over to me, where I got to do a little bit of skin to skin, and they tucked her underneath, like in between my breasts, underneath my gown. They closed me up, everything went great, transferred me over to a stretcher, and they took me back over to the recovery area. So again, some places actually give you a labor and delivery room when you're a C-section. For a scheduled C-section, we actually have, where our ORs are, we have a pre-op and a post-op area, just like a normal surgery. So I went to the post-op area for recovery. We stay in recovery for 2 hours, and there I got to bond with her. I got to breastfeed. I got to just lay there and enjoy her. It was so special. Oh my gosh, and it still brings tears to my eyes, even though this is my second time around and I've talked about it so many times. It's just still such a miracle. It's crazy to me. And I deliver them on the daily. I deliver babies all the time, and it's still such a miracle to me. So in recovery, I got to have Andres back there, of course. My mom came and Bia came, and essentially the entire time I sat there with her on my chest, skin to skin. We breastfed a good amount of time, and They checked on her. They came and took her vitals. The RNs that I work with, that's what we do. We check on the babies for the first 2 hours. We check on mom. We do fundal checks, which is the top of your uterus. We push down on it to make sure that your bleeding is okay. A lot of people don't think that you bleed after a C-section. You definitely still bleed. You have your typical vaginal bleeding. I do have to say, vaginal bleeding with a C-section is often less and for a lot less time than a vaginal delivery, because you don't have any vaginal trauma at all because you have a big gaping incision in your stomach. There's a huge difference. So yeah, it was an awesome experience. Like, overall, I could not have asked for anything better. I'm so grateful for the experience that I had with Maddie, because even though it was less than perfect, it allowed me to appreciate Autumn's experience that much more. It was amazing. I loved it. So I don't know what else to say. It was a very awesome labor and delivery experience. I know a lot of you probably don't have an awesome C-section experience, and a lot of moms feel down about themselves having a C-section, and trust me, I felt that the first time I did. I felt it. I thought, oh my god, what a failure I am. I'm going to be in pain for a much greater amount of time than I would have been with a vaginal delivery. My body didn't work right. I had already had trouble getting pregnant the first time around. I felt like a failure. I truly did. But you know, being in the industry and seeing all the things that can go wrong and all the things that it takes for your body to actually deliver naturally, it just is no wonder why lots of moms have C-sections. And a lot of doctors are impatient too, and that has a lot to do with having a C-section. So my number one tip to you guys is, if you truly want a vaginal delivery and you feel like you can do it, push your doctor. Make them give you more time. Make them be more on your side, not just impatient, running the clock type of thing. And that's coming from a labor and delivery nurse who works with these impatient doctors. I mean, it happens all the time. My doctor is amazing, and in hindsight, as much as I felt like a failure with Maddie, I know with my medical knowledge now, being a labor and delivery nurse, I know there was nothing else that could have been done. Nothing. I was already too far gone. There was nothing that could have been done. I was withstanding an infection if I had continued to be without my amniotic fluid. Like, she had already broken my water. There was nothing else that could have been done. I had to have a C-section, and you know, it is what it is. There's nothing that I could have done about it. And now looking back at it, again, like I said, there's no regrets on my part, none. I had an amazing experience with Autumn, and I feel like it helped us bond, and I feel like working there, like, the nurses knew how important different things were to me, and it just was an overall wonderful experience. So I will be doing a 3-month postpartum video, and in that video I will be talking about right after recovery. So, because essentially my postpartum is after you have the baby, so I talked about up through the time of having her and being in the recovery room. The next video I will talk about my recovery from the second I had her until now. So I hope you guys enjoyed this labor and delivery story. Let me know in the comments down below. Again, I have that knowledge. Ask me any questions that you want, whether it be about a vaginal delivery or a C-section, or if you want to ask me privately, you can always message me on Facebook or Instagram. I have those linked down below, as well as my email. I'm always willing to help answer questions and give you guys some insight of how I would handle it as a nurse, or how being a patient is a little bit different, things like that. Again, I have nothing bad to say about my experience, but I'm sure a ton of you guys have had not so great experiences. So anyway, I hope you guys enjoyed my labor and delivery story, and we will see you in the next one. Bye!